Okay, we should be.
It says live.
Okay, awesome. I love that you saw that. I was still on the other screen. Okay, welcome. We are so excited to be on Facebook Live to share a little bit with you all tonight. My name is Nicole Featherstone. I am an ambassador with Noonday Collection, and I am here tonight with my dear friend Ann Kramer. Ann is the co-founder of Maya Health Alliance in Guatemala, and she will be telling you more about that in just a couple of minutes. Ann and I have been friends for many years. We went to college together at Ball State University, and we are sorority sisters. And we also share a passion for advocacy and global work. And so that has really kept us in touch over the years. And I've loved watching what Ann has been doing and the work that she's been doing and the impact that she's been making in Guatemala. And so we're so excited to partner together tonight. So we are doing a global give back, gather for global good Noonday Collection show. And the proceeds from this show will benefit the Maya Health Alliance, along with some other organizations as well. So I'm excited to tell you more about that. But before that, Ann, would you tell us a little bit about the work that you've been doing and the collaboration that you've been doing in Guatemala?
Yes, thank you so much, Nicole. It's so wonderful to be invited to do this with you. I love the passion you have for Noonday, and I think I share it very much from my work at Maya Health Alliance. Maya Health Alliance, we started 15 years ago. I'm a co-founder. I originally went to Guatemala in order to do research for my graduate work, and I got really interested in really what was happening there with the local communities, the rural indigenous communities, and really what they lacked in access to healthcare and education. And myself and some others, we worked together to found Maya Health Alliance. And basically what we're trying to do is help people access healthcare. So in Guatemala, you may not know, is that there's over 20 languages spoken in a very small country. The country is the size of Ohio. So if you can imagine traveling just one city to another, and people speak many different languages. And what happens in Guatemala is the government does not provide healthcare in many languages, really only in Spanish. So we really are trying to fill that gap in care. We currently work in 6 different languages, and we hire all local Guatemalans. So we have nurses and doctors and health promoters. And many of them are rural indigenous women. Over 86% of our staff are women. And they're in their communities speaking their language, helping to provide healthcare in what we call last mile care. So really going to very far rural indigenous communities that you have to sometimes walk for hours to get into the communities to provide them the care they need. And we focus heavily on chronic conditions, such as diabetes, hypertension, child malnutrition, women's health, cancer care, basically things that the government is not really prepared to do, especially in these rural areas. My team, we have over 60 staff that are working across the midsection of the country, and we serve about 20,000 patients a year. We're very proud of the work that we do. We're changing lives. We're helping provide people education around healthcare in their language. We're often empowering women. Many of our staff feel really proud of the work that they're doing. And our staff are really the heart of our work. Many of them are women. They take their backpacks and they can go far off into the communities and do pap smears in the home. They do education around nutrition for children, for women when they're pregnant. So we do a lot of care in the communities, which is so important because many of our patients that we're serving are artisans, just like the ones that work with Noonday. Many of these artisans, they live in their communities and they can't really find access to global partnerships. They can't sell their goods on the global market. And so it's so great what Noonday is doing. Our nurses are out there working with artisans or working with local farmers, providing healthcare that otherwise they couldn't access. And something that we've done over the last several years that I'm really excited about is we work with universities in the United States, and we do what's called implementation science. And basically we're trying to test everything that we do, all of our interventions, our healthcare that we're doing, to make sure it really is effective and that we're really having the high quality impact that we want for our communities. We publish this work, we share this work, and now we're using that publication, the information and the data and the results to help change policy in Guatemala. So we're trying to change the nutrition policy and really make a difference across the country, and not only in the communities where we work, and really change the trajectory of the future. Unfortunately, in Guatemala, it is has the highest rate of malnutrition in this entire hemisphere, sadly. And so we have a long way to go to help children have a better future. So I love partnering with you, Nicole, because we're really looking at, passions that we have to help others. And when we come together as a group, we can really do a lot more. And right now with COVID and everything that's happening, unfortunately, Guatemala is really being hit hard right now. Our organization is working hard to do telemedicine and basically talk to all of our patients online through WhatsApp, on the phone, doing the best we can to teach them about the situation of COVID. We've put out informational videos and radio ads in 10 different languages so they can reach as many communities as possible. And we're providing food to as many people as possible, because a lot of people don't have jobs right now, they don't have transportation, and people are hungry. So, partnering with a team like yours, we can do more and provide more to our patients who need so much.
I love that. And one of my favorite things that you hear a lot within the Noonday community is that we're better together. And that is so true. And that is what you're saying, that when we are able to link arms together, our impact is so much greater. And so I know you and I talked last week, and I was asking, so what are the greatest needs right now in light of COVID? And you were saying food, just the food shortage. And we're hearing that from several of our other artisan partners around the world, just that the food scarcity is a huge issue and a danger right now. And so I mentioned at the beginning, that is why Noonday is so excited to do these Gather for Global Good shows. 10% of sales from this show will go to emergency relief efforts for Guatemala and countries around the world. So this is an opportunity to really link arms and provide support and emergency relief where it is most needed. And then 10% of sales from this event will go directly to Maya Health Alliance. And again, supporting all of the incredible work that Anne just mentioned. And then really the impact is threefold. So we're supporting Maya Health Alliance. We're supporting this global emergency relief effort, but then also every Noonday purchase helps to create jobs in impoverished countries. So if you're unfamiliar with Noonday Collection, we are a fair trade jewelry company working to create jobs in vulnerable communities around the world. We currently partner with artisans in 15 different countries. And over the last 10 years, we have been able to either create or sustain over 4,000 jobs. So really making a global impact. And as Anne mentioned before, I love what you shared, that your artisans are working in rural areas, and because of that, they don't have access to quality healthcare, so you're going to them. And then I love that because we support artisan businesses, they are again able to work where they live, in their villages, in their communities. So cultures are preserved, communities are preserved, families are preserved, because moms and dads are able to still be living in the community with their kiddos, but also have access to a dignified job and a livable wage. And so one of my favorite parts about being a Noonday ambassador is that I give men and women the opportunity to use their purchasing power for good. So when you do business with an ethical company, you are saying yes to one set of practices and you are saying no to another set of practices. And those practices include how their employees are treated. if they're paid fairly, if they work in safe conditions. And so sometimes I think we can look at the world around us and look at all the brokenness and think, oh my word, there's nothing I can do. And that just isn't true. That's a lie. So simply by doing business with ethical companies, you are making a difference. So anytime you make a purchase through Noonday Collection, you are helping to create jobs around the world, and you're helping to provide sustainable jobs, dignified jobs with a livable wage. And that translates to some pretty powerful things. That is fighting oppression. We also partner with an artisan group in East Asia that is actively rescuing women currently out of human trafficking situations. And so those purchases literally lead to more rescues of women who are then given counseling, rehabilitation, healing, and then they go on to receive a dignified job and a livable wage, and they're able to support and provide for themselves and their families. So our goal was to make this video short. We could talk about this all day long. If you want more information about Maya Health Alliance or Noonday Collection, please comment and we would love to get back to you or reach out to us personally. I am so excited, Anne, to see how we can make an impact for Guatemala. In addition, so it's Thursday night. Any purchase made tonight or by noon tomorrow, Friday at noon, will all of those people will be entered to win free Noonday, just as a little bit of added fun. But we thank you so much for watching. Thank you for listening, and please reach out if you want any more information.